Gamma knife, as people might think, is not an actual surgery. In fact, it is a radiation treatment that employs a very highly focused beam of radiation, and due to its precision, hence it was called knife. The treatment can be usually one or more than one treatment, but in the majority of cases, it's a one-off treatment therapy, and the treatment is done using a specific machine after having acquired targeting imaging for the brain and the lesion, and the treatment time can be varied depending on what we are treating. Treatment has now become one of the primary treatment options for a lot of neurosurgical indications, including tumors, benign tumors, such as vestibular schwannomas, other tumors like malignant tumors, some vascular conditions of the brain like arteriovenous malformations, and also for certain pain conditions like trigeminal neuralgia. Gamma knife treatment, compared to other treatment options, most notably as surgery, is considered relatively safe. This is due to the fact that it is multidisciplinary. It's a teamwork or a team effort to deliver the treatment, and it's backed by quality assurance and quality checks all through the way of the patient treatment. There can be some risks. However, these risks are kept to a minimal, and it can be variable. But again, these risks are considered to be very small compared to surgical treatment. Is employed for treating a variety of neurosurgical conditions, including benign and malignant tumors, certain vascular conditions of the brain like arteriovenous malformations, and also certain pain conditions of the brain like trigeminal neuralgia. These by far represent the majority of the indications for gamma knife, and they are conditions that used to be primarily treated with surgery before. But gamma knife treatment has proven itself to be a safer treatment and a less invasive for all the patients. The gamma knife treatment is very effective in controlling the tumor growth in the majority of the tumors, including benign and malignant tumors. The safety profile of gamma knife has been tested thoroughly, and despite being some risk of complications, it is regarded as the least invasive form of treatment. And one of the risks is associated edema or swelling in the area next to the target that's being treated. But these risks can be mitigated with certain medication like steroids if they do occur, usually for a short period. Some patients who, for instance, may have epilepsy or seizures, with successful treatment, there has been reports that epilepsy would actually reduce the risk of epilepsy, reduce the risk of further seizures, and possibly manage to reduce their medication as well.